Hello, it's Dr. Rhonda Johnson, and today is Sunday, June 13th, 2021. And today I'm going to be talking about the Delta variant, which was formerly called the Indian variant. But first, I always like to start off with the good news. The good news is that the 7-day average of new daily COVID infections here in the United States is down to around 16,000 almost, according to Johns Hopkins University data. Now that's down more than 60% from roughly a month ago, where the daily coronavirus new infection was around 45,000 people who got infected daily. Now this sharp drop in COVID cases has to do with one thing, well, probably a couple, the fact that people are outside more, but also because Americans are receiving vaccines. More than 308 million doses of COVID vaccines have been given here in the United States, and that's the good news. So now for the not so good news. I'm going to discuss this Delta variant, which was first detected in India, was called the India variant, and renamed by the World Health Organization on June 1st to the Delta variant. This Delta variant is gaining ground fast, really fast, around the world. So let's first look at India. In the continent of India, I am so sad to report that over 6,000 people died yesterday from COVID-19. That is one day, over 6,000 people. And that only includes the official number of people who died in the hospital, not the number of people who died at home or who died in the streets. Let's look at China. The Delta variant has spread to China. Chinese doctors have been reporting that the symptoms of the Delta COVID-19 variant are different, they're more dangerous than the original version of the coronavirus. Chinese doctors, according to published news sources, have found that patients infected with this Delta variant are becoming sicker, and their conditions are getting worse at a quicker speed. According to the Chinese doctors, as many as 12% of the patients have become severely or critically ill at around day 3 or day 4 after their symptoms first develop. Now, previously, folks, only 2 to 3% of patients had become severely or critically ill, and that was usually in the second week of COVID, not the first 3 to 4 days after developing symptoms. So that's different. And also more patients have high fevers, according to the Chinese doctors. Now we're going to jump to the United Kingdom, where the Delta variant has outpaced and outplaced the UK variant. You remember the UK variant, now they're calling it the Alpha variant. The Delta variant is now responsible for 90% of coronavirus infections in the UK. 90%. And early data out of the UK shows that the Delta variant is 40 to 60% more infectious than that UK variant, which was highly infectious. Now, coming back home to the United States, the Delta variant is here. It has beaten out the South African variant here in the United States. It's been detected in 28 states. And medical experts are looking at the southern states because they have the lowest rate of vaccination in the U.S. And they're saying, concerned that the southern states could feel the impact of this highly transmissible Delta COVID variant as early as late summer due to low vaccination rates. In some states like Mississippi and Louisiana, only 30% of people, of adults, have had their full dose of vaccines, and less than 10% of adolescents are vaccinated in many of the southern states. And remember, folks, mostly all of the coronavirus infections are occurring in unvaccinated people. So what does this mean for you and I? No matter where you live, you're going to have to stay informed. You're going to have to know where this Delta variant is. Assume it's in your community. And I want you to use common sense, even if fully vaccinated. Why? Because we know that factors such as age and comorbidities can reduce the effectiveness of our body's immune system. Our immune system is a function of our overall general health and a function of our levels of stress. So if you're stressed out, your immune system's probably not working at its best. And none of us know our individual titers, our antibody titers to the SARS-CoV-2 virus. For folks who have had natural infection and who have natural immunity, or for people who have had the vaccine. Unless you're in the vaccine trials, no one's really measuring your levels of antibodies, folks. Those tests are just not being done. So we know this virus has evolved, folks. It's getting better and smarter at doing what it wants to do, which is infect people and replicate itself. And we people are providing the best opportunity for this virus to outsmart us because we have so many people who refuse to get vaccinated. So folks, live your lives, but know this situation with these variants is going to be disruptive and unpredictable. Personally, I've decided that I'm going to continue to practice common sense. I'm going to keep wearing my mask in public places. Why? Because I don't know who's vaccinated. I am going to choose my activities so that they're outdoors as much as possible. And folks, we have to continue to talk to our family members, our friends who are unvaccinated, to encourage them to become vaccinated. It may not make a difference, but at least you know you have tried. So feel free to use this video to share it. And the bottom line, folks, is we're better off vaccinated, period. For those who haven't gotten the COVID vaccine, please don't wait until it's too late. There are a lot of people in the ground who didn't get a chance to choose, and these variants are going to make an impact. That's my message for today. This is Dr. Rhonda Johnson. As always, my views are my own, and my only attempt is to help save lives. Have a blessed day.